Good afternoon, class. My name is Paulette Holt, and I'm a registered nurse at our local hospital. I am going to talk to you about asthma, a disease that has become more prevalent in the last few decades as our environment has changed. It is estimated that asthma affects over 34 million Americans, more children and teens than adults. Most of us know someone who has asthma. We will be covering the causes and features of asthma first. Although the actual cause of asthma is not known, it is a chronic disease of the airways that makes breathing very difficult. It can be inherited from your parents, we do know that, but the actual cause, it can only be explained by its features and its symptoms. Asthma has three main features. The first feature is airway obstruction. In normal lungs, the airways are relaxed and air can move freely through the passageways. In asthma, allergies, colds, respiratory viruses, pollution, dust mites, fumes, exercise, and other triggers can cause the airways to tighten and become very narrow. Smaller airways restrict breathing, and the air cannot move freely anymore. Air that moves through these narrow passageways makes a whistling sound known to all of us as wheezing. Take the straw that I gave you with your handouts. Now put the straw in your mouth and breathe only through your nose. Inhale and exhale several breaths through the straw like this. You will notice that you became short of breath. Can you imagine breathing through this straw with an asthma attack? That's the way it normally would feel. This is a similar experience of how an asthmatic may feel when their airways are obstructed. Look at the picture in your handout, the first one on number 1. Notice the narrow passageway that must move oxygen in and out of the lungs. Now look at picture number 3. The air passageway of mild asthma is not nearly as inflamed as the chronic remodeled airway that was not managed well. These narrow passageways produce the symptoms of coughing, shortness of breath, tightness, and wheezing. The airway narrowing is reversible, however. The second feature of asthma is inflammation. The person with asthma has swollen bronchioles, where the oxygen is exchanged with CO2. The bronchial tubes themselves are also swollen, as you can see by the pictures. Treating this inflammation becomes the key to long-term management of asthma. The third feature of asthma is airway irritability. The airways of people with asthma are more sensitive, and they tend to overreact to even the slightest triggers like pollen, animal dander, dust, pollution, and fumes, things that wouldn't bother people that do not have asthma. There are ways to prevent asthma. Triggers are things that set asthma off. Each person who has asthma needs to know what their triggers are in order to prevent future attacks. It can help to keep a diary because sometimes it may be a combination of triggers, as some triggers are not obvious, like mold or cockroaches. Some of the more common triggers are air pollution, allergies, cold air, the flu, or a respiratory illness, sinus infections, smoke, fumes, fragrances, household chemicals like Clorox, ammonias, dust and dust mites, feather pillows, down comforters, and cat and dog dander. Avoid people who have respiratory illnesses like colds. If exercise triggers an attack, consult with your doctor, and you may be able to take a medication prior to the exercise, like the inhalers. See an allergy specialist to help control allergies that can trigger your asthma attack. Get a flu shot every year, and be careful at school to stay away from classmates who have respiratory infections. Wash your hands frequently. Always carry your rescue inhaler and peak flow meter to school. Your peak flow meter can tell you if the amount of exhaled air that you are exhaling is normal for you or if your airways are getting inflamed or swollen. Your school nurse should know all about you and have a plan of action in writing in case you have an asthma attack at school. Do not inhale secondhand cigarette smoke and do not smoke if you have asthma. It is thought that 20% of asthmatics smoke. They have more severe disease, more frequent hospital admissions, a faster decline in lung function, and a higher risk of death. Know when your asthma is getting out of hand and you need to go to the emergency department. Call 911. Do not go by private vehicle. You cannot receive medical help if you are in a car. If you are having an asthma attack and it's severe, if you're having difficulty breathing or even difficulty speaking, maybe not even being able to get out a full sentence, if you are more anxious than usual, have chest tightness and wheezing when inhaling and exhaling, do not hesitate to call the ambulance. The paramedics can help you on their arrival and begin life-saving treatment that you could not get otherwise. If you are the patient's classmate, call for him and get the school nurse. There are many more advanced treatments for asthma today than there used to be, and asthma is now easily managed with these treatments. Besides preventing triggers, something that you can do that cause asthma attacks, it is important to follow your doctor's treatment plan. You can manage your symptoms with confidence with the medications that are available today. Asthma medications can save your life, and then you can live an active life. Inhaled steroids are the most important treatment for asthmatics today. They prevent attacks by reducing the swelling and mucus production in your airways. The steroid makes the airways less likely to react to triggers. Inhaled steroids are maintenance therapy, not rescue inhalers. They are taken daily, and results are usually seen in 1 to 3 weeks. Some of the more popular inhaled steroids are Advair, which is a combination of a steroid and a long-acting bronchodilator, Flovent, Pulmicor, Symbicor, which is also a combination bronchodilator and steroid. These steroids and combos come in metered dose inhalers or in a solution that can be put in a nebulizer. Most of you have probably seen a nebulizer breathing treatment. It looks like a pipe that you smoke. These inhaled steroids have few side effects and are safe for children and adults. These drugs are the cornerstone of asthma therapy. They reduce the frequency of attacks, and rescue inhalers are used less because of them. They also help improve lung function and life-threatening events that happen. If a patient's asthma cannot be managed with these drugs and these drug combinations, there are other treatments that your doctor may prescribe, like the use of a short-term oral prednisone, leukotriene modifiers that can improve airflow, like Singulair or Accolade and Zyflow. Effectiveness of treatment can be measured by the fewer asthma events that you have. If a patient uses a rescue inhaler more than twice a week, then his or her maintenance therapy of a steroid bronchodilator combination that is used daily is not working, or the dose needs to be upped, or the patient is not following the regimen his doctor ordered. Or maybe you're not avoiding the triggers. Or it could be that there is a new trigger that you do not recognize. In that case, the patient needs to find the trigger and inform his doctor of the setback. Lifestyle changes can also help with your asthma. If you smoke, the number one thing is to quit. And if you cannot quit on your own, there is help to quit smoking. Ask your physician about this. While there is no specific diet for asthma, it is thought that obesity is associated with more severe asthma. You can avoid foods that you know you are allergic to because allergies are a known trigger. Several researchers have suggested that eating highly processed foods could be partly to blame for our risk in developing asthma. People who eat more fruits and vegetables because of their high vitamin content and the natural antioxidants are thought to lower the developing risk of asthma. Teenagers with poor nutrition are more likely to have asthma symptoms, and those who don't get fruit and vegetables have poor lung function. Those who eat a Mediterranean diet, which consists of nuts and fruits and vegetables, are less likely to have asthma. Exercise is also an important part of healthy life, and even though you have asthma, you can exercise. Your doctor will show you how to medicate safely if you have exercise-induced asthma. Short periods of exertion are generally well tolerated. If you suffer from stress as a trigger, learn ways to cope and relax, and speak with your doctor about managing that stress and ways to get it under control to avoid future asthma attacks. Although stress does not cause asthma, just living with asthma can be stressful. Seek help from experts and specialists if you are feeling overwhelmed. Link up with others who have asthma and seek current information from websites like the American Lung Foundation or the Asthma and Allergy Foundation of America. You as teenagers can live a normal, healthy, productive life with asthma if you learn how to manage it. Good luck and thank you.